So my name is Dr. Bremmer. I'm an interventional pain physician here at CAMC. What that means is we use minimally invasive procedures and techniques to address people's pain, to help live them better lives and essentially increase functionality. Chronic pain as a category is the number one, is a leading cause of morbidity in the United States right now. It is actually a huge issue. The number of patients that suffer from chronic pain is, you probably know somebody. It's 1 out of every 2 people pretty much. The nice thing about spinal cord stimulation when it relates to back pain, it's that it's one of the therapies that is really a durable therapy, and the results you get from it are just really amazing.
My back pain began probably about 4 years ago. Just started hurting, you know, I would get like the sharp pains down my leg. Went to the doctor, it would go away. A couple months later it would come back. And then probably about 2.5, 3 years ago, it didn't go away at all. It just constant burning, shooting down my leg, wouldn't stop. Back pain affects everything. You don't realize it until you have back pain. It affects your whole entire body. You can't sit for very long. You can't stand for very long. You can't, every movement hurts.
Spinal cord stimulation is broken up into those 2 parts, the trial phase and the permanent phase. For the trial phase, we basically place the electrode into the epidural space, or the space that's just outside the spinal cord. So you use a minimally invasive technique that's done through needles, through a needle, just like you would for an epidural for labor or for a spinal injection. But rather than placing medication, we actually place the catheter. Or the electrode. For the permanent phase, the only addition to that procedure is that we then would actually make a pocket, incision it in a pocket to place the generator. Patients that are candidates for this type of procedure are patients that have had any type of what we call nerve pain, and there are specific diagnoses that that it's approved for. But typically, the common denominator is the pain has to be coming from a nerve problem, whether nerve dysfunction, whether it be a diagnosis like complex regional pain syndrome, whether it be from after a surgery called post-laminectomy syndrome, if they've had a back surgery, or if it's just pain going down the leg from a nerve in the spine.
I love Dr. Bremmer. He's a great guy. He really, like the first day I walked in, he said, it doesn't matter what we try, what we do, we will not stop until you get to where you can handle it. And when you come from somebody who says, I can't help you anymore, that means a lot. It's great. It's amazing. When I woke up on the recovery table, she said, what do you feel? And I just started crying because I was like, I don't feel anything. It's probably the first time in like about 4 years that I hadn't felt anything. I would absolutely recommend this to anybody. And I've probably referred about 6 people to his office. Because once you find something that works, you want everybody to know. Like, you don't have to live like this. It's okay. It's a whole new world.